Welcome to Nirvana Essence, Anti-Arthritic chair-based yoga exercises, session 2 for the lower body. If you suffer from an arthritic condition, do not exercise if you are having a flare-up. Wait until the inflammation has died down before attempting exercise. Gentle movements can be beneficial in increasing the capacity and range of movement and increasing your mobility. Decreases acids and toxins that tend to lodge within the muscle fibrils and in the joints, and can help to reduce pain. Work within your own range of movement and work with awareness. Make sure your chair is stable and secure, and sit comfortably and have a cushion at your back if you wish to, and sit slightly forward on your chair and hold the sides of the chair for stability during some of these exercises. We're going to start off by focusing on your feet. To tense and release your toes, so just curl your toes up, tense them and release. Are we ready? 8 times. Tense, let go, and 2, and 3, and 4, and 5, and 6, and 7, and 8. Wiggle your toes. Try to get all of your toes moving. As much movement in the joints of your toes as you can. Wiggle them. Really work at it. Okay? And then put your feet down again, and once again tense and release the toes. You ready to pull the toes in? 1 and release, and 2, and 3, and 4, and 5, and 6, and 7, one more, and 8. Lift your toes up, wiggle them. Try and get those joints moving. Keep going, wiggle your toes. Really work at it, and you'll find the peroneus longus muscle at the side of the shin bone is moving, and this is the muscle that you're going to tone up whilst you do this kind of movement, which is going to help your balance and help to strengthen your stability, and then allow your feet to come down. Raising your heels up and then your toes. Lift the heels together 8 times. You ready? Lifting up, down, 2, 3, 4, 5, 6, 7, and 8. Put your heels down, lift your toes up, push the heels into the floor. Up, down, 2, 3, 4, 5, 6, 7, 8. Press the toes into the floor. You're ready to lift your heels. Up, down, 2, 3, 4, 5, 6, 7, and 8. Lower the heels down. Now lift your toes up. Up, down, 2, 3, 4, 5, 6, 7, and 8. Separate your feet a little bit. Turn your toes in and out. And 2, and 3, and 4, and 5, and 6, and 7, and 8. Take the balls of the feet into the mat and lift your heels. You ready? To lower and lift. 1 and 2, 3, 4, 5, 6, 7, and 8. Heels push into the mat. Lift your toes. Up, down. 2, 3, 4, 5, 6, 7, and 8. Turning the toes in and out, and 2 and out. 3, out. 4, 5 and out, and 6, and 7, and 8. Up onto the balls of the feet, lift the heels up, down, 2, 3, 4, 5, 6, 7, and 8. Heels down, lift your toes. Up, down, 2, 3, 4, 5, 6. Well done on 8. Good. Bring your feet closer together and straighten your feet up. Ready for a walking movement. As you would walk, your heel pushes into the mat, the ball of the foot and the toes. So like as if you were walking. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Well done. Bring your feet down, flat on the mat, rocking gently from side to side across the bones of your feet. So spread your toes and then rock onto the sides of the feet. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. Walking. 1 and 2 and 3 and 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. Feet flat, rocking across the bones of your feet. Hold on to your chair. You ready? 1 and 2, 3, 4, 5. Spread your toes. 6, 7, and 8, 8 and 7, 6, 5, 4, 3, 2, and 1. Well done. Shake, 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 and shake. Bring your right heel slightly forward. A rotation of your ankle by tracing a circle with your toes. 1, 2, 4, 5, 6, 7, 8. The other way. 1, 2, 3, 4, 5, 6. Feel the stretching of the attachments to the ankle. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. Push your heel away. Point the toes away. Heel, toe. 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. You should feel the warmth of circulation starting to flood into the sliding joints of the ankles all around the ankle area. Okay, raising the right foot slowly forwards. Rotation. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6. Well done on 8. Push the heel away, point the toes away. 1 and push, and 2 and 3 and 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. Lower your foot down. Can you feel the warmth now? You should start to feel that warmth circulating within your feet. It's very beneficial, anti-arthritic in its effect, as we wash away any acid deposits that tend to lodge within the joints. Starting on the knees now, what you need to do is just raise your right foot up and put your right hand underneath the thigh. Hold the side of the chair with your left hand for stability. Lift the toes of your right foot off the mat. Trace the size of a dinner plate. All that's moving is your knee, not your ankle. You ready? 1, 2, 3, 4, 5, 6, 7, and 8. Go back to 12 o'clock the other way. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. Lovely. Lower that foot down. Raising up the left foot. Place your hand underneath the thigh. Only your knee is moving, not the ankle. Trace the size of a dinner plate. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7, and 8. Again. 1, 2, 3, 4, 5, 6, 7, and 8. The other way. 1, 2, 3, 4, 5, 6, 7. Well done on 8, and lower your foot down. Excellent. Okay, now again for your knees, we're going to lift the knee up. Do what you can. If you can't go very high, just put your hands on your shin and pull in. If you can't do that and you want to do it with one hand, you can do it like that and just pull the knee gently upwards. Okay, so whether you want to use 2 hands or 1, if you want the stability, just keep your left hand on the side of the chair and lift with your hand underneath the kneecap, a slow lift. Up and down, and 2 and down, and bend and down, and 4 and 5 and 6 and 7 and 8. 8, 7, 6, 5, 4, 3, 2. Well done on 1. Lower down. Change hands. You can put your right hand on the side of the chair, or you may use both hands if you're quite stable on your chair. It's your choice. So let's take the left hand underneath the kneecap, raising your toes off the mat, ready for the lift. You ready? Up, up, down. 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Bring your foot down. This also, of course, helps the hip joint, so you're moving your hip joint. We're now going to take the knee out to the side and work on the hip joint also in working the trochanter of the hip. So again, you can support your leg if you wish to, either have the hand at the back if you want to lift like that, or at the front, whichever you prefer to do. Some people find it easier to put the hand underneath the back of the thigh like that and lift the leg to the side. So do whichever one you want to do. I'm going to put my hand at the back of the thigh because if that's the easier way. If you want to bend the knee more, if you're more able and you're able to bend your knee more, you can do that. It's a little bit more difficult. So I'll do the easier way on this side and the more difficult way on the left side. So I'm going to place my hand underneath the back thigh just to demonstrate this. Make sure you're sitting upright and your chair is stable. Lift your toes off the mat. We're going to take the knee out to the side. Are you ready? Slowly. 1 and back, and 2 and back, 3 and 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. That's a lot harder than it looks. And lower down. Excellent, well done. I'm going to demonstrate it with my hand on the lower part of the kneecap on this side. So don't forget to stabilize yourself if you're doing this by placing your right hand against the side of the chair, sitting upright, lifting your toes off the mat. Okay, now I'm going to do it a little bit higher for those of you who are more able and able to do that. Otherwise, just repeat what we've just done. Okay, are you ready? 1 and back, and 2 and 3 and 4, 5, 6, 7 and 8, 8 and 7 and 6 and 5 and 4 and 3 and 2 and 1. Lovely. And lower down. Lovely. Well done. So that will work on your knee and your hip joints. Right, now if you want to extend it a little more, I'm going to show you a couple of exercises which you can do where you're going to bring your right foot to the inner part of the calf of the left side, and just hold onto your shin or onto your knee. Okay, and then stabilize yourself by holding onto the chair and just drop the knee out to the side. So drop and lift and 2 and lift and 3 and 4 and 5 and 6 and 7 and 8 and 8 and 7 and 6 and 5 and 4 and 3 and 2 and the last one, 1. Now, if you can, bring your foot up onto your thigh. Okay, and just hold your ankle with one hand to your knee with the other hand and gently stretch. You probably find at first that your foot is like this, but just do a little movement. Whatever you can do is good. Ultimately, the heel will come into the groin, the foot will turn sole uppermost, and you will start to open up your ankle, your knee, and your hip, bouncing gently. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1, and keep smiling. Okay, release and lower down. Good. Bring your left foot onto your calf, the gastrocnemius muscle. Okay, stabilize yourself by holding onto the chair and taking your hand under the knee. And you can take your knee out to the side. You ready? 1 and 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. That stretches the longest muscle of the body, which is the sartorius. Okay, so if you feel you can go on, you can continue by bringing your foot up. If you don't want to do that, just do a few more of these movements, but otherwise take your foot onto the opposite thigh, holding onto your ankle with your right hand and your knee with your left hand, and gently bounce the knee. Nothing extreme, tiny movements to encourage the opening of the joint and the stretching of the sartorius muscle. Okay, and then gentle stretching. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Release and bring your feet down onto the mat. Right, now we're going to do a little exercise which is called a Sufi Roll. And this movement, you need to sit a little tiny bit further forward onto your chair, but you must hold onto your chair, hands on either side for support. I'll show you the movement. We're going to drop the body forwards, have the feet separated, hip distance apart. We drop forwards. We roll to the right. We roll back and look up at the ceiling. We roll over to the left. And then we roll forwards again, and that's the position that you want to be in. So would you like to take that up? Lean forwards. Okay, make sure your feet are hip distance apart, your chair is stable. Roll to the right, roll back, roll to the left, roll forwards, roll to the right, roll back, roll to the left, and forwards. Again, roll right and back and left, then forwards, and finally roll to the right, roll back, roll left, working into your pelvic region, into the sacroiliac joints as you do this movement. Lengthen forwards, hold on to your chair. The Sufi Roll. Go to the left side, roll left, roll back, roll right, roll forwards, roll left, roll back, roll right, roll forwards, roll left, roll back, roll right, and forwards. 1 more. Roll left and back and right. Roll forwards. Lengthen your spine. Feel that stretch. And slowly, slowly come upright. Sit comfortably. You can touch your forefingers and thumbs together in Jnana Mudra. That's the wisdom mudra for the last few moments now as we meditate upon good circulation for your joints. Close or lower your eyes. Watch the flow of the breath as it rises and falls within your nostrils. The cool air rising and the warmed air descending. Sense and feel the rise and the fall of the breath for a few moments. A calming breath. As you now begin to focus your mind upon the lower body, start with your toes. Imagine spaces within the joints of your toes, all of your toes, and the warmth of circulation gently flowing through all of your toes, soothingly, flowingly warm. It bathes your feet and moves into and around the sliding joints of your ankles. Imagine spaces within the joints, loosening, and feel the warmth of circulation gently passing through them. The gentle warmth bathes your legs and moves up and into both of your knees. Imagine spaces within the joints and feel the warmth of circulation, soothingly, flowingly warm, flowing through the joints, washing away all acid deposits from your joints. The soothing warmth flows up through the upper legs to your hips. Imagine spaces within the joints. Deep spaces within the joints and the warmth of circulation flowing soothingly, flowingly warm within your hip joints, washing away all acids from the hips. Let the warmth bathe your pelvis, easing away all tensions and pain. Let it flow through your spine, from the base, the tailbone, right up through the sacrum, through the lumbar spine, up to your mid-back. Spaces within the joints. The vertebral column. Feel the spaces there as the discs become more buoyant, plumping up, lifting away the pressure from the roots of all spinal nerves and letting circulation bathe your spine. Soothingly, flowingly warm. You are releasing all the hidden tensions. Return to the rise and the fall of the breath within your nostrils, the cool air rising, the warmed air descending. And then open your eyes. And that is the end of the second session of the anti-arthritic exercises. Namaste.